Thank you very much, everyone, for attending, and welcome to this webinar on depression and depression in children and young people. My name is Ellie Jones, and I'm the Service Improvement Lead for Sussex CAMHS, but I previously worked in East Sussex CAMHS for many years as a consultant psychologist. And my colleague Dominique is also here.
Good evening, everyone. Yep, my name is Dominique Mossman. I'm a consultant clinical psychologist working in East Sussex CAMHS.
Thanks, Dominique. Firstly, to say that depression can be a sensitive and difficult subject to talk about, and it can touch the lives of many of us. Please look after yourselves in the webinar. If you need to take a break, please do take a break. And remember that you can always watch this recording later on if you want to. And although the webinar can't be massively interactive tonight, we'll do what we can to break up the slides and the information. We'll be doing some polls, which we hope you'll contribute to. There'll be a short video to watch on depression. And also we've got some audio recordings to listen to, which have been created specially for the webinar by a young person, an expert by experience, who we have working with us in CAMHS. Now, depression is quite a large topic, and we may not be able to cover everything that you'd like us to today, but hopefully the webinar will be useful to you. We'll take about 90 minutes and we'll have a break about halfway through. Next slide, please, Sophie. So this is what we're covering today in the webinar. We're going to start off with looking at some statistics on depression, and then think about what is depression, what symptoms there might be, what risk factors lead to depression, treatment and how you might help, and also what support is available. Next slide, please. Thank you.
Okay, lovely, thank you. So we are going to just make a start on looking at the statistics and having a look at how common depression is in young people and children in the UK. So we know that in the UK, young people are experiencing mental health difficulties at a higher rate now than ever before. In 2020, we know that 1 in 6 young people aged between 5 and 16 experience mental health difficulties, and this compares to 1 in 9 young people in 2017. A survey carried out by the NHS in 2022 suggests that 18% of children and young people aged between 7 and 16 years had a probable mental health disorder. And when we look at a slightly older age group, those aged between 17 and 24 years old, this percentage goes up to 22%. When we look specifically at depression, NHS NICE guidance estimates that 1% of children before the onset of puberty have depression, and that 3% of children after the onset of puberty have depression. Other estimates include that over 7% of children aged 12 and over have experienced moderate to severe depression. And a study carried out in 2017 suggests that, or estimates that this could be as high as 24% when we look specifically at girls aged 14 and over. Next slide, please. Okay, so we're going to look at this particular study, a couple of graphs from one study which was published in 2019, which looked at the development of depression through adolescence. So on this graph, depression symptoms are going up along the side. With increasing depression, the higher the line goes up. And across the bottom there, we've got age in years. And what we can see is that in late childhood, so aged 11, 10, 11, there are low levels of depression symptoms. But by the onset of adolescence, so at the age of around 13, what we start to see is a sharp increase in symptoms, and that this increase continues until the age of 18, 19 years. Next slide, please. Okay, so this is the same study, And it's looking at the development of depression across the course of childhood through to young adulthood in males and females. So again, we've got age along the bottom there in years, and depression symptoms going up the side axis. In this graph, we've got two lines. The solid line represents males, and the dotted line represents females. What we can see here is that at age around 11, there are similar levels of depression in males and females. But over time, though, what we see is a much steeper increase in depression symptoms in females compared to males across adolescence. We don't completely understand why this may be the case, but what we do know is that for girls, the onset of puberty is now earlier than it used to be. And as a result of this, they're having to deal with experiences, complex, difficult feelings at a much younger age, and potentially before their kind of brains have caught up with their physical bodies, and so they're needing to deal with all of these experiences and feelings, perhaps before their brains have fully matured and enabled them to cope with these feelings. And we also know that social media has a greater impact on girls compared to boys, and we know that girls are much more affected, particularly in terms of their self-esteem, by what they're seeing, reading on social media.
Thanks, Dominique.
Thank you.
So we're going to do our first poll now. And the question is, what word or words come to mind when you hear the term depression? So if you could just pop those into the poll, and we should be able to see a live Wordle where the words that you write down are coming in, and we can see them coming in live. Hopefully.
Hopefully you can see that, can you? Perfect.
Yes. And words are starting to come in, yeah. And with this Wordle, the more a word is mentioned, the bigger it becomes. So low is obviously being mentioned quite a few times, yeah. Darkness, yeah, feeling sad, anxious, upset. Hopeless. Isolated. Yeah. Coming up, irritability, yeah. Shall we just give it another 10 or 15 seconds for people to put things in? There's some really great words in there that really describe depression. Lovely. Thank you very much for that. We're going to be going back to some of those symptoms as we go on further in the talk. So shall I share my screen now?
Yeah.
So, great. Just get this right place. So So what is depression? So most children and adolescents will go through periods of feeling down, just like we might as adults. But depression is when there's a persistent or prolonged period of low mood, and this is weeks and months rather than just days, with the following characteristics. So you might notice an unhappy or irritable child, changes of attitude towards family, friends, school, and life in general. You might notice some marked changes in eating or sleeping habits, and it can be associated with recurrent thoughts of death or suicide. So just looking at those differences between what might be low mood and what might be called clinical depression. So low mood is that feeling down, experienced intermittently, and it's short-lived, and possibly as a result of something happening like a friendship breakup, but they usually fade. So those symptoms usually fade, and we can still usually encourage a young person to keep going and keep engaging in daily activities. But depression or clinical depression is where the mood doesn't lift and starts to have a significant impact on functioning. And it becomes a real struggle. And we can often separate symptoms of anxiety according to 4 different categories. So mood changes, which I think lots of you have noticed on the poll, sadness and irritability. Social relationships, young people can tend to start avoiding social relationships, become withdrawn and isolated. They might have difficulties in relationships, and they might begin to have poor ability to solve challenges that used to solve quite easily before. And we might notice cognitive changes. So in concentration, we might notice low self-esteem, feelings of helplessness, and again, suicidal thinking. And we might notice some physical symptoms, changes in sleeping, in eating. A young person may become quite apathetic and struggle with activity. So I'd like to now show you a short video on depression, which I think gives a really nice general introduction to it, and I hope it will play.
I have it ready, Ellie. If you want to stop sharing, then.
I think it might be starting.
Oh, is it starting?
Yeah.
We used to think that children could not get depressed. We used to think that they were emotionally immature or cognitively immature, but in fact, children and even
Sorry, Ellie, the video's not actually showing. It's just
Okay. So
the
it's
voice.
shown on mine. So I'll stop screen sharing then, Sophie,
Okay.
and then you can take up the video from yours.
we used to think that children could not get depressed. We used to think that they were emotionally immature or cognitively immature, but in fact, children and even very young children can get depressed. All children, as they grow up, will feel sad. It's part of growing up. It's part of learning how to regulate one's emotions. But some children will develop a sense of sadness which persists. And it is those children that we need to be worried about. Depression is associated with serious complications, poor school performance, impaired social relationships, a recurrence of depressive episodes or depressive disorder as they grow up. And in the worst case scenario, the end result may be suicide. So the main symptoms of depression are feeling sad for prolonged periods with worsening of these feelings and feeling as if fun has gone out of life.
Parents and teachers are often the first to identify the symptoms of depression in young people. Some cases might be obvious, others less so. If children are visibly unhappy or uncharacteristically irritable for at least 2 to 4 weeks, with these feelings lingering or worsening, they may be depressed. A child suffering from depression may have difficulty concentrating in the classroom, appearing persistently irritable, worried, tearful, moody, or bored. Problems with sleeping, overeating, and undereating are also common. Any risk-taking behaviours, suicidal thoughts, or evidence of self-harm must be addressed without delay. Many of these symptoms can be found in people suffering from depression at any age, but there are additional symptoms that can be visible, more specifically in young people. Young children who complain persistently of aches and pains or other non-specific physical discomfort may be depressed. Teachers and parents might notice changes in peer relationships or social withdrawal. Children may not want to play and visibly lack enjoyment in activities. They may not want to spend time with family and friends and isolate themselves, but equally they may be clingy and unwilling to separate from them. Depression can cause children to lose interest in their general appearance. Over time, there is a drop in academic performance.
Simply moody or unpredictable children should not be diagnosed as being depressed. A child who doesn't want to go to school on a Monday morning is not depressed. In order to fulfill the diagnosis for depression, a child must display a range of symptoms, and those symptoms have to be sufficiently impairing to alter their day-to-day functioning.
Teachers and parents should also be aware of the factors which can put children at risk of depression. Among them are bullying and problems with or lack of self-confidence and inability to keep up at school. At home, if there is discord within the family or if other members of the family are depressed, children can be at risk. Exposure to drug and alcohol use or adversity including child abuse will inevitably put a child's mental health at serious risk. Other life events such as moving away from home, experiencing bereavement, or suffering other illnesses may bring a degree of instability and render a child more vulnerable to developing depression. The more risk factors present in home and school life, the more likely it is that a child could become depressed.
Another form of depression is dysthymia. Dysthymia denotes milder feelings of depression which last for a longer period of time. Children who are dysthymic are often perceived by their peers as being moaners, and the teachers see them as complaining excessively. The danger with dysthymia is that this chronic state can often exacerbate into depression proper. The immediate advice a teacher can give or a parent implement is to ensure that the child has a regular routine, including a sleep routine, a balanced diet, and that they exercise sufficiently. The teacher may need just to watch the child and see what happens over a course of time. Very often, the symptoms are understandable within a context, and there are good reasons why a child may be feeling sad. Parents and teachers must use their judgment. If the symptoms persist, if they worsen, then they should be referred either to the GP or to the SENCO or school nurse.
Children do recover, but depression can recur and can become chronic, so continued vigilance is required. Some children are much more vulnerable to stresses and untoward life events than others, particularly in the presence of biological and environmental risk factors. It is difficult to diagnose depression in young children as they may not be able to describe their feelings. Teachers should not be afraid of asking questions, the same questions one would ask an adult. Are you unhappy? What is making you unhappy? Do you cry? Do you feel bad about yourself in any way?
Sophie. I'll go back to screen sharing.
Lovely, thank you.
Thank you. Just need to go back up. So let's just recap what we might look for as parents in children who may be depressed. So we've got this loss of interest in things or activity that were previously enjoyed. We've got changes in eating patterns, eating more or less than usual, and there could be significant changes in weight that you might notice. Teenagers may increase their use of alcohol or substance misuse, and most often we see the overuse of cannabis in our clinics. And I think young people report that they feel cannabis is helpful in numbing the pain and helping their mood, but in fact, it's quite difficult because we know that substances like cannabis can really have an impact on the structure and the functioning of the brain. Sleep changes, you might notice that your child is sleeping more or less than usual. And again, they might frequently complain of headaches or stomach aches. They might be more irritable than usual. They might be more upset or seem miserable and lonely. They may cry more often than usual. They may be avoiding friends or social situations. You may notice that they're being more self-critical and expressing worthlessness and low self-esteem. And self-harm and suicidal thinking, you may see an increase in this or a start of this. And this is actually a really hard thing to think about and talk about. It's difficult for young people to talk about this and share their experiences with their parents and carers, or anybody actually. And it's really hard for us as parents to manage and know what to do. And if we're not going to go into this in too much detail in today's webinar, but there is a specific webinar that you can watch on this topic, and it's called Managing Self-Harm and Suicidal Thoughts. It's on the CAMHS website if you want to know a little bit more about this. Again, you might see an increase in anger, expressions of guilt, self-blame and anxiety. And you might notice a difficulty in concentration and paying attention. And there may be some teachers on the call, and what schools may notice and teachers may notice is poor concentration and attention, which is talked about on the video. We might see a drop performance, and there might be a loss of interest in schoolwork and doing well, which wasn't there before. There may be truancy, disruptive behaviour, and also friendship difficulties. So can we do poll 2? And this question is, what factors may lead to depression in a young person? So what factors do you think may lead to depression in a young person? I'll stop sharing now, Sophie.
Okay, thank you. Here we go.
So the words are beginning to come in. Media, yeah. Issues. That might be linked to another word. Social media, absolutely. Genetics. Group pressure. Insecurity.
I've got a couple in the chat, Ellie. Family
Yeah.
breakdown, bereavement, friendship
Yes.
issues.
Yeah. Lots of words coming in now. And lots of people thinking about social media and the impact on young people, absolutely. Insecurity, yeah. Undiagnosed autism and bullying, yeah. We'll hear a little bit about that from our expert by experience in a minute, actually. It's a good point. The world around us, I think that's absolutely right, particularly the impact of COVID has been specifically hard for children and young people. bereavement, yeah. Okay, should we just give that another 15 seconds? Hopefully
Okay.
people have had a chance to put some words in. Thank you very much for engaging in that poll. Really important points that you're raising.
Lots of good words this evening.
Yeah, lots of good words. Yeah, racism, absolutely.
Okay, I'll stop the poll now.
Okay, thank you. And I will go back to screen sharing.
Thank you.
So thank you for those really astute and interesting words that you've mentioned there. So let's have a think about some of those risk factors that you have mentioned. And sometimes we don't know why a young person gets depressed. Sometimes we don't understand that, but sometimes there are some very obvious risk factors. It's important to remember that low mood can coexist with other mental health problems such as anxiety, and also that sometimes depression can be undetected in young people because often it can be put down to normal adolescence behavior or just hormone changes. So family history of depression, someone mentioned genetics in the poll. It's estimated that around 20 to 50% of adolescents with depression may have a family history of it. Negative life events such as, a huge one that we've noticed is COVID-19, that massively impacted on children and young people. Death of a loved one. There are many different negative life events that may be a risk factor for young people. Socioeconomic adversity, and we know that financial hardship can cause massive strains on families and can lead to adversity and also inequality. Family discord, I think this has been mentioned earlier by you all as well, and significant conflict at home, parental separation and divorce, particularly if the separation has been acrimonious, can be a real risk factor. Trauma, past or present, and bullying, past or present. And again, we may not be aware. Sometimes we are aware of bullying and trauma in our young people and our children, but sometimes we're not because they don't tell us. And that can be really difficult because we don't really understand what's going on for our young people or children until they really tell us. And sometimes they're just not able to. Increased academic or social demands. And I think there's massive pressure on children to perform, to do well in exams, and social media, which you've already talked about and lots of you have mentioned. Chronic illness is another risk factor, particularly as it can be really stressful to have a chronic illness, and it brings with it anxiety and pain, which can be really high risk factors for depression. Substance misuse we've talked about. And also there's emerging evidence that personality might have an impact. So there's emerging evidence that young people who tend to be more introverted and with a tendency to be more anxious and experience a lot more negative thinking may be at more risk of developing depression. So now, just before the break, I'm going to play you a recording that has been done for us by our expert by experience. And this is their journey of depression and their story. It's quite difficult to listen to, but it's a really compelling story. So I'm going to play it to you. It's in 3 parts, but I'll just play it back to back.
I'm 18 and I live in Brighton with my mum. I'm still working on my mental health, but here's my past experiences. Everyone has different experiences with their mental health, so what worked for me won't work for everyone, but I hope this is helpful. to some of you who are supporting other young people who are struggling at the moment. I personally was very embarrassed about my mental health throughout my school experience, which wasn't helped by the fact that social anxiety was a big part of my life. I first started to feel low when I was in year 7, but I ignored it. I was struggling with blushing and going red in front of people, and that took over my life. Throughout year 7 and 8, anxiety was a really big problem for me, and it came out in ways that I really regretted and made me not like myself. It got so bad that I really struggled to speak. When I tried to, my throat would close up. In year 9, I had a friendship breakup, leaving me feel rejected by my whole friendship group. Due to my anxiety, I was zoning out a lot and found it really difficult to be aware of what was going on around me. I now know this was dissociation, a way of coping. I was trying 200% all the time, and this was the first period where I was down for a long time, and I thought it was probably depression. Year 10 and 11, I started high achieving at school. Everything else around me was failing, and so I focused on schoolwork. I was isolating myself from others around me, and I was having trouble with food at the time, becoming obsessed about it. What I now know is that I was struggling with undiagnosed neurodiversity. Year 11 was when my depression became obvious to others. I reached a point where I couldn't mask my difficulties anymore. I was completely zonked out. My whole body felt like it was shutting down. My concentration was getting worse. My speech was slower. I couldn't be bothered to try and look people in the eye anymore. And it was a relief not to be trying so hard all the time. I was rejecting my mental state. I didn't realise depression was an illness. I thought it was easier than living with high anxiety. This is when my parents noticed I was depressed, but were left wondering where it had come from, not having been aware of all the struggles I had been having before. I went to the doctors and got referred to CAMHS. I also went to counselling for 8 sessions through school, but it didn't help. That summer was when things got really bad. When school stopped, I didn't really move anymore. Schoolwork had been what I had been focusing on, and without it, I got extremely depressed. I didn't want to go outside. I didn't want to talk. I got really hyper-focused on suicide. I wanted help with killing myself. It's really hard to remember that period of time. I was becoming much more sensitive to sensory experiences and acted impulsively. Doing more was a way to intentionally make me feel worse because it burned me out. Feeling suicidal made me feel like everyone was against me. I went to a private psychologist before I started year 12, which didn't help. During year 12 was when I was at my worst. I did drama therapy at this time, which was sort of helpful. I was telling everyone that I was going to kill myself. No one knew how to help me, and it felt like no one took responsibility for me. I was absolutely convinced there was no reason to live, and no one could convince me otherwise. In year 13, a few changes happened that had a positive effect on me and helped change my perspective and begin to feel a bit better. I found out I had autism. Finding out I was autistic gave me hope that things could change. It also gave me something else to focus on other than suicide and depression. Decisions related to me and my life were focused around my mental health. My family began talking openly about mental health, and thinking about what was right for me now, I began to feel hopeful that I would get support, and I felt I had more of a say in my life.
So listening to that young person's journey, it just highlights really just how complex mental health can be and just how many areas of life it can affect for young people. I think it also highlights for me young people and our children really struggling to share their experiences with us, even when we have good relationships. It also talks about finding it hard to seek help and get the right help at the right time. But also they talk about that importance of parents spotting the signs of depression and trying to keep open and compassionate communication. And also for this young person, a diagnosis was really helpful. And in that case, it was a diagnosis of autism in helping them move forward with their life. So we're going to take a break now for 5 minutes. And then we're going to come back and look at treatment and how we might help.
Thank you. Okay, so we're now going to think about treatments for depression. And there are two kind of main treatments that we typically use, and these are talking therapy and medication. And sometimes these two types of treatments will be used together. So I'm going to start by talking a little bit about talking therapies. So there are many different forms of therapy, and these generally involve talking about our thoughts, feelings, and life experiences with a trained professional, such as a psychologist or a CBT therapist. And this process can help the young person to spot unhelpful thoughts and behaviours, and to help them think about what they can do to change these patterns. And cognitive behavioural therapy, or CBT for short, is the most common evidence-based form of treatment. And it's a type of talking therapy used to understand how a young person may think about things and to change any behaviours that aren't helping them. It's normally very practical, and the therapist might ask the young person to put into practice things that have been discussed in their sessions, in their day-to-day lives. And the young person may then come back and report back to their therapist about how they found doing that in between their sessions. And the overall aim is to help the young person to apply skills that they're learning in their sessions into their daily lives to help them manage their difficulties. And CBT is very much a collaborative kind of working together treatment, and it can be delivered in various formats. And so it can be done on a one-to-one basis with the child or young or adolescent, or in a group, or with the young person and their parents or family. For mild to moderate depression, what we term as low intensity CBT can be provided in settings such as schools and colleges. And this is typically done on an individual or a group basis. And low intensity CBT is it's a form of guided self-help. And it's often offered as a first step in services, usually lasts for between 4 and 8 sessions, and focuses on key techniques, excuse me, to help a young person manage their symptoms. Excuse me. For moderate and severe depression, what we term high intensity CBT is offered, and this is usually delivered individually. And high intensity CBT goes into much greater depth and detail around our thoughts, feelings, and beliefs, and tends to last somewhere between 8 to 20 sessions. And aside from CBT, sometimes other therapies are used to treat depression, and these include family therapy and psychodynamic psychotherapy. And there is some evidence which tells us that family therapy can be particularly helpful when a young person is experiencing suicidal thoughts or is self-harming. Medication can be used to treat depression, and this, when medication is used, it's usually one of the SSRI antidepressants, such as fluoxetine. And when medication is used and recommended, it's usually offered alongside one of the talking therapies for depression. Okay. Thank you.
This is our last poll now. And the question is, what might you do if you thought your child or young person appears depressed? GP, yeah. Encourage. Think about school, maybe Senko advice. Yeah. Maybe that's encouraging conversation. Empathy. Connect. Google. Google will be very helpful for giving us information content. I've got grandparents in there.
I've got a couple from the chat. Doctors allowing them a safe space.
Yeah. Professionals. Listen. Music, yeah. Really good ideas here.
Another one from the chat is just to provide support.
Yes. Yeah, absolutely.
Exercise.
Really good one. Which is
Oh, here's a good one. Journaling.
Journaling, absolutely. Journaling can be a wonderful way for a young people to write down thoughts and feelings. And especially if they don't want to talk to you, sometimes just showing you what they've written might be helpful to start a conversation if they can't talk.
We've got spending quality time with the child.
Yeah.
Paint therapy.
Yes, yeah. These are wonderful. Sharing experiences, yeah.
Sunshine.
That often helps us, doesn't it? Being outside, feeling the sun on our faces. Yeah, absolutely. So shall we just spend another 10 or 15 seconds?
Yeah.
Green space, yeah, being outside. There's lots of evidence about green and blue spaces really helping depression. So by blue space, I mean sea, lakes.
Yeah, I've got a few more of those. Growing plants, gardening,
Lovely.
pathfinders, pets.
Yeah,
Always a good one.
it is. Okay.
Okay.
Shall we? Thank you so much. They're really brilliant ideas. Thank you. So I'd like to now play a recording from our expert experience about what helped them and some top tips for depression for parents and carers.
What helped me? Diagnosis of autism and understanding myself more. Supportive adults having a mutual sense of dark humour. Having an adult who cares about me to talk to, but who isn't a part of the family. Medication, to some extent. Distraction. I didn't want to be alone. I watched lots of films with my mum. Letting me rest. Being given more choice and control over my life. My advice for parents and carers young people struggling with depression, don't reason with them. When feeling very low, it was not helpful for me to have a parent trying to change my opinions / views about things. This just felt like arguing and made me feel worse. I knew my mum loved me and cared about me, but when I was very low, I thought I didn't care about this and could be mean. But actually knowing this and hearing it from my mum has helped me through. It is really important for parents and carers to look after themselves and to address their own difficulties, whether this is with their own mental health, relationships, and circumstances more generally. What's going on for them does have an impact on as their children. If you have doubts about a potential diagnosis for your child, figure this out, do research and process this away from your child. Don't let them know that you don't believe it to be true. Having to convince your parents of something can make you not feel heard. Yeah.
Some really good ideas and top tips
I'm
there.
going to support as advice for parents.
Definitely play, sorry.
Just trying to move it on. Here we go.
Yeah, absolutely. Okay, over to Dominique.
Lovely, thank you. So just going to think through a few things, just maybe some further ideas, although I think lots of ideas have just actually been covered in the poll and indeed those clips just there from the young person. But yeah, we're going to think about how you can help your young person or child with depression. So, okay, if we could have the first one. Lovely, thank you. So firstly, to try and open up a conversation about going on. So you might start by letting them know that you've noticed that they don't seem very happy. Just voicing your concerns for them in a very caring and non-judgmental way. Next one, please. So listen without judgment. So sometimes talking about our problems and our feelings are very, very difficult, but just being able to do that and to feel heard can really, really help. And it's not always easy to listen to someone that we really care about to discuss difficult feelings, but try not to judge or offer solutions unless they ask for them. And to try again another day if they don't want to talk. And young people often find it quite difficult to open up about how they're feeling because they don't want to worry or upset anyone, particularly when they feel very close to that person. So just by letting them know that you're ready, you're there, and you're there when they're ready to talk, and that you want to hear about however they're feeling can be really, really helpful and reassuring. Next one, please. So providing emotional support. So try not to ask too many questions or come up with quick solutions or gloss over their sadness. And I think the young person has just talked about that very thing. But it's really important to empathise with how they're feeling and remember that they've taken a risk by opening up to you. And so letting them know that they can talk to you as often and for as long as they need to can be really, really helpful. And also just try not to take it personally if you find yourself on the receiving end of anger or frustration or sadness, because this can often be a sign that your child or young person trusts you and feels safe with you in order to express some of those difficult feelings. But it is, having said that, completely understandable if this sometimes becomes or feels too much to manage for you as a parent. And remember that if that does happen, that it's a really good idea to ask for professional help and advice. It's important to kind of think together about whether there's anything in particular that's making them feel this way. So this might include, and again, some of these things have already been mentioned, but this could include problems with friendships or family relationships, or being bullied or feeling left out at school, being overwhelmed by schoolwork, and struggling with significant changes such as separations in the family, or indeed a combination of these things. And it's really important to think about whether any changes, whether that's at home or at school, could make things easier for the child or young person. Next one, please. Okay, celebrating achievements. So for someone who is struggling with depression, small things or seemingly small things like getting out of bed, brushing your teeth, taking a shower, going to the shops, or indeed leaving the house can actually feel really overwhelming. And it can be very, very helpful to recognise when your child has managed to do one of these things, and to let them know that you've noticed that they've done that, and to say that you're proud of them for doing so. Next one, please. Keeping enjoyable activities going is really important. So encouraging your young person to think about what they enjoy doing usually, and then taking a step-by-step approach towards helping them to do these things when they feel able to. And this could be things like doing some exercise, playing a sport, listening to music, again, already been mentioned as something that can be really helpful, doing something creative like drawing or watching a film, reading a book, or going for a walk with you. Next one, please. Keeping daily routines going, again, is really important. So supporting your young person to do the daily things that support our well-being. So this includes things like getting up at a regular time, eating regular healthy meals, doing some exercise, drinking water, spending quality time with people that we love, and getting enough sleep. And just to say that teenagers need at least 8 to 10 hours of sleep a night, so perhaps more than we do as adults. And then also it might be helpful to think about limiting screen time as part of this. Next one, please. Oh, I can't see that one. That's behind here. Sorry. Just going to.
Dominique.
Being there for them. Okay, yes, absolutely. So it can be very difficult to socialise if you're struggling with depression, but spending time with people who care about you can really help to feel less alone. And finding activities that you can do with your child to spend time together without pressure, like watching a movie or playing a game, can be really, really helpful. It's also important to think about or to support your young person in thinking about who they've got in their support circle. And they might even want to keep a list of the people that they trust and that they feel they can reach out to for support when they need it, together with their contact details. So, you know, they can think if they are feeling particularly alone or low, that they can kind of look at their support network and think about who they want to reach out to and speak to. And doing this exercise with your young person can really help them to feel less isolated and remind them that they've actually got people in their lives who really do care about them. Next one, please. So giving reassurance, it's really important to let them know that you love them, that these feelings won't be there forever, that they will recover and they will get better, and that together you can help find support when things are really difficult. So reassurance around, they've got people around them, got people who love them, and that these feelings aren't going to be there forever. Next one. Lovely, thank you. It can be helpful to make a plan for the really difficult times. So this might include asking them, what kinds of activities they can do when they're really struggling, who they might find helpful to support them in doing those activities. So together you might be able to explore the type of support that they would find helpful for you as parents and from others, and the kinds of activities that would help them to feel better. And last but not least, the services that they can get in touch with when they feel that they need support. And finally, it's really important to look after yourself and really remember that it's not your responsibility to fix everything. Although I know as parents it can feel like that, but absolutely it's not your responsibility to make everything okay, and to make sure that you've got time for yourself and that you're looking after your own well-being too. Okay, next slide please. Lovely, thank you. So this slide is covering a small list of agencies that are available nationally to support young people and families affected by depression. So the first one I'm sure you will be aware of is Childline, and this is a free helpline for children and young people. It's fully confidential. And provides telephone counselling for any child who is experiencing difficulties. You can see there they've got a helpline and a text phone, and that they are operating Mondays to Fridays morning through till quite late in the evenings, and also Saturdays and Sundays from late morning until 8 p.m. Then we've got The Mix, which offers free support and advice for under 25s. And again, it's a confidential helpline with online chat and discussion boards, and they've got a helpline. And then we've got Youth Access, which is information and advice on counselling services for young people between 12 and 25. So if you look on their website and click Find a Service, that gives details of services available. And then there's hopeagain.org.uk, which is a bereavement charity, which helps young people come to terms with bereavement and deal with their feelings as a result of bereavement. And then we have Young Minds, which includes a parents' helpline, and the number is there, you will see. And they've also got a very, very helpful website, youngminds.org.uk, which I would absolutely recommend that for both parents and young people to have a look at. Okay, thank you. Next slide, please.
So if we have a look at what support is available, particularly in Sussex. So we've got the Sussex Mental Health Line, the number is there, and that offers support, advice, info and signposting around mental health. It's free and it's available 24/7. And sometimes if young people can't face calling, there's a texting service there as well, and they just text that number and start a chat. And again, it's day or night 24/7. iRock is available in both West and East Sussex, and iRock offers a range of free support for people ages 14 to 25 around mental health, emotional health, relationships, bullying, housing, education and employment. And you can book an appointment in person, or you can do a drop-in virtual phone call or just a call. And they do offer up to 3 sessions as well of some low intensity work as well. If you're in Brighton and Hove, you'd go to the Wellbeing Service, and the number is there. And again, free service for all ages from 4 years upwards. And they offer psychological therapy. Yes is the Youth Employability Service. And this offers free advice and counselling, particularly for young people who are aged 16 to 18 who are struggling to get into education or employment, or at risk of not getting into school. Mental health in schools teams. Now they cover most schools, but not all. But they do fabulous work for mild to moderate depression and all sorts of mental health issues. They provide one-to-one evidence-based interventions in schools for things such as anxiety and depression. And they also give advice to school staff to help young people get the right support and stay in school. And then there's also Amaze, which is a charity that gives information, advice and support to families of children and young people with special educational needs and also disabilities in Brighton, Hove and Sussex. There are also lots of other fantastic free services out there. We can't list them all, but this is just a taster. And next slide, please, Sophie. There's also, of course, CAMHS. So I would really encourage you to have a look at the CAMHS website. There's all sorts of resources on there, not just about what CAMHS does and the professionals involved in CAMHS, but lots of resources for parents and professionals and young people that are very separate, but can be really helpful. And I just wanted to particularly show you a bit of the website, which is referrals. So if you go into the website and if you're really worried about your young person, you can have a look into the referrals section of the website and just look at what we recommend at various levels of symptoms for your children and young people. So it gives a kind of traffic light system of green, amber and red. So in green, it's generally a young person may be experiencing some difficulties which are fairly common, but they're short lasting. There's a limited impact. And this is the kinds of advice that we would recommend. So self-help resources, talking to friends and family, maybe getting some support from school or the GP. And then if we go into amber, which is maybe the need for a little bit more help. So common worries causing distress that's more expected than usual. So more frequent sadness, some impact on functioning, which has lasted more than a few weeks. You may begin to look at the advice on this section here, and that talks about school nursing team and pastoral support. It talks about counselling services, one-to-one and group supports, helplines, and the kinds of organisations that we've talked about too. And so then the last one is the red category, which is where difficulties are becoming more severe and more enduring, and there's significant distress. So, for example, with depression, that's when you'd be really worried about eating, sleeping, mood, lots of changes, social withdrawal. And this is when you might make a referral to CAMHS. And how to do that is also just on this drop-down menu, and it depends obviously where you live. So if you're in West Sussex, you would click on the West Sussex link, Brighton and Hove or East Sussex, you click on that link and it gives you all sorts of advice, both crisis and how to make a referral to CAMHS. So I'd really recommend you have a look at that CAMHS website. There's all sorts of information there. So thank you very much for coming to this webinar. We hope you found it useful. Thank you for engaging in the polls. And although we can't do Q&A live, do give us some feedback and stay on to take the survey at the end of the webinar. So thank you very much, and I hope you have a good rest of the evening.